Well, moving on, other breaking news today, other important news. And I think sad news is that the BMA have confirmed that there will be more strikes, more junior doctors' strikes, this time in the run-up to Christmas and in the first few days of the new year, including, I think, their longest ever doctors' strike. Well, I'm delighted to be joined by Dr. Arjan Singh, who is part of the Junior Doctors Committee at the British Medical Association. Thank you so much, Doctor, for being with us.
Thank you.
This is very unwelcome news, frankly, to the whole nation at any time of the year, but in particular in the run-up to Christmas. I mean, surely this is not going to gain you any friends, is it? Much sympathy by doing it just before Christmas, is it?
I agree that the news is not welcome. No one wants to go on strike, especially doctors, especially during this period of time. But we've been in negotiations with the government for a while now, and whilst the relationship has definitely improved since our time with Steve Partley, which was a mitigated disaster, we still haven't moved quite enough. And unfortunately, it has been proven time and time again that strike action is the only way to prod and poke this government into action. Now, I will say, if the government can give us a credible offer now, tomorrow, the day after, even on the day of the strike, we'll call them off. It is in the government's power. Unfortunately, we are just too far apart at the moment.
I mean, you say it's the only action, but in the private sector, Doctor, actually negotiations take place. Very few people in the private sector go on strike. You've had an offer of 8.8%, as I understand, plus another 3%. Most people in the private sector are not getting these sort of offers. They don't get the sort of generous pensions. I'm sort of thinking, are you being a bit greedy here? We all want doctors to be well motivated and incentivised, but I'm coming back to this point about I'm not sure you're bringing the public with you.
I don't think we're being greedy at all. Our ask is pay restoration, and percentages can be misleading when you're talking about very small numbers. But we're asking for a doctor in their first year to get paid £20 an hour. And it's interesting that you bring up the private sector. But according to the Financial Times, and using their own index to work out pay cuts, we've had a pay cut more than 10 times higher than the average private sector worker over the last 14 years. Our pay cut has been horrific, and we're just asking for it to be restored, and that's £20 an hour for a doctor with huge student debt. And unfortunately, if we don't pay doctors, they are going to leave. We work in a global market, and there is a shortage everywhere.
I think, and I'm very sympathetic to the concern about student loans, student debt, which I think is another huge scandal, something that I've talked about elsewhere. Is there any form of what I would call performance-related pay within this package at all, or is that not possible, or just completely unwelcome and off the table?
There's been no talks of performance-related pay. I think you have to understand we don't have enough doctors. We're seeing 500 British people die every single week in the NHS because there aren't enough doctors. That is a national scandal. Our National Health Service is an abomination. And the care that people get in this country, they've worked their whole lives to get, is truly horrific. And it's because there's not enough of us, because we can't retain doctors because of the pay.
But I'm wondering, actually, if there's not enough doctors and you can't retain them, I'm thinking, well, maybe some form of performance-related pay may help. I'm obviously not here to sort of negotiate, but I'm just interested because that's quite common in the private sector. Doctor, thank you so much indeed. I think, you know, it's desperate news for the nation in the run-up to Christmas at a difficult time anyway. We will obviously keep abreast of this situation. Dr. Arjan Singh, thank you so much indeed for being with us here on GB News.